Did you know that some common medications you might be taking could increase your risk of developing dementia? These aren't rare prescriptions. They're medications many people use every day, and some of them might surprise you. Let's find out which ones and what you can do about it. Welcome to Trending Health. In this video, you're going to learn about 8 medications that have been linked to cognitive decline and even dementia. This isn't about scaring you, but making you aware of potential risks and empowering you to take control of your health. Knowing what to look out for can make all the difference, especially as we age. Many people unknowingly take medications that could be contributing to memory problems, confusion, or general cognitive decline. And it's easy to miss the connection. Sometimes these side effects can be subtle or mistaken for normal signs of aging. But here's the important part. These changes might not be inevitable. Certain medications, when taken long-term, can alter brain chemistry, increasing your risk for conditions like dementia. These drugs can affect how neurotransmitters function, slow down brain processing, or interfere with brain health in other ways. Unfortunately, some of the most commonly prescribed medications used to treat everything from allergies to high blood pressure have been shown to impact cognitive function. So, how can you tell if the medications you're taking are part of the problem? That's what we're here to explore today. Let's break down each of the 8 medications that have been linked to cognitive decline. As I go through each one, I'll explain what they're typically prescribed for and how they can potentially affect your brain health. First on the list are anticholinergics. These are a broad class of drugs commonly used to treat allergies, bladder issues, and even sleep disorders. The problem? These medications block a neurotransmitter called acetylcholine, which is essential for memory and learning. Long-term use of anticholinergics has been associated with a higher risk of dementia. Some examples include Benadryl, diphenhydramine, tolterodine, and certain medications for Parkinson's disease. If you're using any of these regularly, it's worth having a conversation with your doctor about alternatives. 2. Benzodiazepines. Next up are benzodiazepines. These are usually prescribed for anxiety or insomnia and include drugs like Valium, diazepam, Xanax, alprazolam, and Ativan, lorazepam. While they can be highly effective in the short term, long-term use has been linked to memory problems and cognitive decline. Benzodiazepines work by slowing down brain activity, which can be helpful for calming anxiety, but over time, they may impair cognitive function and increase the risk of dementia, especially in older adults. 3. Sedative hypnotics. If you're someone who struggles with sleep, you might have been prescribed sedative hypnotics. Medications like Ambien, Zolpidem, and Lunesta, ezupagliflozin, are designed to help with sleep, but their impact on brain function can't be ignored. These drugs slow down brain activity, which is helpful for inducing sleep, but their side effects can include memory loss, confusion, and drowsiness that lasts well into the next day. Prolonged use can lead to a higher risk of dementia. 4th, statins. While statins are widely prescribed to manage cholesterol levels and reduce the risk of heart disease, some research has suggested a link between these drugs and cognitive issues. Statins like Lipitor, atorvastatin, and Crestor, rosuvastatin, work by reducing cholesterol in the bloodstream, but because the brain also relies on cholesterol for proper function, there's concern that statins could potentially interfere with memory and cognitive health. However, it's important to note that this area is still being studied, and the benefits of statins for heart health are well documented, so don't stop taking them without consulting your doctor. 5. Antidepressants. Many seniors take antidepressants to manage symptoms of depression, but certain types, especially tricyclic antidepressants like Elavil, amitriptyline, and tofranil, imipramine, have been linked to cognitive decline. These medications affect neurotransmitters in the brain, and while they can be highly effective in treating mood disorders, their long-term impact on memory and cognition can be a concern. If you've been on a tricyclic antidepressant for a while, talk to your doctor about whether a different class of antidepressants might be a better option. 6. Opioid pain medications. Opioids are commonly prescribed for chronic pain, but their effects on the brain can be profound. Drugs like OxyContin, oxycodone, Percocet, oxycodone acetaminophen, and Vicodin, hydrocodone acetaminophen, not only dull pain, but also slow down brain function, affecting memory and cognitive abilities. Prolonged use, especially in older adults, can lead to confusion, memory issues, and even a higher risk of developing dementia. Pain management is important, but so is brain health, so it's crucial to explore alternatives if possible. 7. Antihypertensives. Beta blockers. Beta blockers like Lopressor, metoprolol, and Inderol, propranolol, are commonly used to manage high blood pressure. While they can be life-saving for cardiovascular health, there's evidence suggesting that long-term use of beta blockers may contribute to memory problems and cognitive decline. These medications work by slowing down the heart rate, but they can also impact brain function, leading to issues like brain fog and confusion, especially in older adults. 8. Proton pump inhibitors, PPIs. Lastly, proton pump inhibitors, PPIs, such as Nexium, esomeprazole, and Prilosec, omeprazole, which are used to treat acid reflux and GERD, have also been linked to dementia risk. These medications reduce stomach acid, but long-term use can affect the absorption of key nutrients like vitamin B12, which is essential for brain health. Research has shown a potential connection between chronic PPI use and increased cognitive decline. So it's important to use these medications only as needed and consult your doctor about other options. The most surprising thing about this list? How commonly prescribed these medications are. Millions of people take them daily, often without realizing that they could be affecting their brain health in the long term. Over-the-counter remedies for allergies, prescriptions for managing chronic conditions like high blood pressure or high cholesterol, sleep aids to combat insomnia, these are part of many people's daily lives. Yet, the potential impact on our cognitive health is something that rarely gets discussed. It's easy to assume that if a medication is widely prescribed or available without a prescription, it's completely safe for long-term use. However, every drug has side effects, and when it comes to brain health, some effects may not be immediately noticeable. They can creep up over time, manifesting as subtle memory lapses, difficulty concentrating, or a general sense of mental fog. This makes it all the more important to stay informed and proactive about the medications you're taking. By being aware of these potential risks, you can have meaningful conversations with your healthcare provider about whether these medications are still the best choice for you. To wrap up, we've covered 8 commonly prescribed medications that have been linked to cognitive decline and dementia. Anticholinergics, benzodiazepines, sedative hypnotics, statins, antidepressants, opioid pain medications, beta blockers, and proton pump inhibitors. These drugs serve important purposes, from relieving allergy symptoms and managing pain to controlling heart conditions and mental health disorders. While they can be incredibly helpful, even essential, for improving quality of life, it's crucial to be aware of their potential side effects, especially concerning brain health. Knowledge empowers you to make informed decisions. Always consult with your healthcare provider to find the best treatment plan that balances managing your health conditions with safeguarding your cognitive function. If you found this information valuable, please leave a comment with your thoughts. Have you taken any of these medications? What's been your experience? Sharing your story could help others in the community. Don't forget to like the video and subscribe for more health insights. Feel free to share this video with friends and family who might benefit from this information. Your health is in your hands. Stay informed and take charge of your well-being.